what is a hip replacement and who would be a good candidate for it? We visited with Dr. Michael Higgins from Tidewater Orthopaedic to get the answers to those questions.
So Dr. Higgins, Tidewater Ortho has been around for 40 years. Tell me more about the practice.
Well, we're an orthopedic subspecialty practice. We have all areas of orthopedics covered, broken down into each subspecialty. So everything from hand to spine, joint replacement surgery, shoulders, sports medicine.
What is your area of expertise, and tell me a little about yourself?
Well, my area of expertise is hip and knee replacement. That's what I did my fellowship in, which is an additional year of training. So I do primary hip and knee replacements as well as more complicated revision hip replacements.
Let's talk about hip replacements, and if anybody's watching and has some hip pain, are they a candidate for hip replacement?
Yes, patients with hip pain or hip arthritis are typically candidates for hip replacement. It depends on what the diagnosis is. Of course, need to be evaluated with x-rays and examination. But patients with hip arthritis are candidates.
How has hip replacement changed, let's say, in the last 10 years? How has it gotten better?
Well, there's been a lot of advances in the last 10 years. One area that's really made the recovery better is pain control. Our management of pain has advanced significantly, which really makes the recovery easier in general. The materials that are used are far better than what they were 10 or 15 years ago. The longevity appears to be significantly better. And then there's new advances in surgical approaches, namely the direct anterior hip replacement. A direct anterior hip replacement is a muscle-sparing way of replacing your hip. So muscles are not cut. The surgery is done working between muscles. Because there's less trauma, it's less invasive, patients have a quicker recovery. There's less pain and less weakness. With the direct anterior approach, patients do have less restrictions after surgery. With the traditional hip replacement, patients are typically instructed not to bend more than 90 degrees at the waist. So that makes putting your shoes and socks on very difficult. They're not allowed to sit in low seats. So that's a pretty big restriction on a day-to-day level, and that's usually in place for about 6 to 12 months. With the direct anterior approach, because it's less invasive and more of the tissues are intact around the hip, the ball is held in the socket very firmly right away. So patients are allowed to sit in any chair they want. They can put their shoes and socks on. They don't have those same restrictions. So from a patient's point of view, that means a shorter stay in the hospital, less time on a cane, less time on a walker, less time in physical therapy, quicker return to the things they want to do.
Hip replacement surgery has proven to be a tremendous asset to so many people. A lot of people are scared about this surgery. What can you say to them about having this procedure done?
Well, you know, as a hip and knee replacement specialist, I feel very fortunate to be able to offer patients one of the most successful surgeries that's done today. Hip arthritis is a terribly debilitating disease. It's very painful. And you know, when you think back at how much people suffered 50 years ago before the surgery was available, it's amazing today to see patients just 2 or 3 weeks after surgery walking without a cane, pain-free, getting back to normal life. So I think if somebody's suffering, they really ought to be evaluated. There is treatment out there, and it's a terrific procedure.
Dr. Higgins, thank you for joining us today on the Hampton Roads Show.
Thank you.
Thanks to our friends at Biomet for bringing us that great information. For appointments, call 757-827-2480, or you can log on to tidewaterortho.com.